Okay, prosthetic joint infection. Pay attention because this is different from a septic joint that belongs to your body. When it comes to prosthetic joint infections, remember that the leukocyte count is usually elevated to around 1,000 versus a native joint can be over 50,000. In the first 3 months, it's usually virulent organisms, so you want to think about Staph aureus or Pseudomonas, and these present with very classic symptoms such as acute pain, fever, leukocytosis, and in the local area, you'll see some erythema or even some drainage. Now then there's a delayed onset infection. This is 3 to 12 months after you give the prosthetic joint. So the patient can have sinus tract formations, their implant starts loosening, or they've been experiencing chronic joint pain ever since they had the surgery. As far as the organisms involved, you want to think about Enterococcus and coagulase negative staph. So this is like staph epidermidis. What is most high yield is that fever and leukocytosis, usually absent at this point. Lastly, you have the late onset, which is maybe even after a year, these patients start having these acute symptoms, fever and joint pain, but they also had a recent infection. That's what's most important. Maybe the patient had a UTI earlier. And the most common of these late onset infections are actually Staph aureus. And Staph aureus is most common because it's coming from a distant infection that became hematologically spread. This is very important, the management. Any red painful joint with any reduced range of motion in the stem, this is considered infectious until proven otherwise. So what do? Even if the patient doesn't even have a fever, you do arthrocentesis with synovial fluid analysis and you culture it. Of course, you do blood cultures if the patient is febrile and if they have very sudden acute onset of these symptoms, and you x-ray the joint as well. Sometimes advanced imaging such as MRI or nuclear medicine could be necessary, and it's also very important to suspect gonococcal arthritis. If it's prosthetic joint infection, orthopedic consultation is necessary and you have to do debridement. You also want to consult infectious disease to have targeted antibiotic therapy, and the patients will be required to start a prolonged course of pathogen-specific antibiotics.